I think the greatest part about shared decision making is about the ability to be empowered to talk about what's going on with me.
The whole idea of empowering patients systematically, I think it's something we always mean to do, but when you have a tool in front of you that is all about educating and empowering patients, it's a way to follow through on your good intentions.
With shared decision making and the WISDM project, the most important message that we're trying to bring out into the community and to the clinics alike is to bring the fact that patients have a say in their health care and how it best fits into their lifestyle. That's what shared decision making is about. With WISDM, that targets this particular project with colorectal cancer screening, allowing us to go into the clinics and meet with patients to be able to talk to them about what their options are with WISDM as it pertains to shared decision making.
Shared decision making does help us break some myths regarding making choices for patients' healthcare, specifically colorectal cancer screening. And I think it's important for them to know the facts in order to make decisions for themselves. Okay. The advantage to shared decision making is you have an RN specialist that's trained in aiding people in making decisions about their health.
When we meet with the patients, we offer them 3 options, and that is either to have a colonoscopy, a fecal occult blood test, or actually the third option that we offer them is not to be screened at all. One of the reasons why the providers like to send patients to us is that we're able to take the time to sit down with the patients, have them rate the pros and cons of the different screening types, and then during our session we actually write down what the patient's pros and cons are. Oftentimes once they see that in writing, it like almost a light bulb goes on and they go, oh, okay, this is really what I want to do.
It didn't take all that long, the educational session. There were things about colon cancer I didn't know, and the nurse knew, she knew so much about it. She was, I guess, just so non-judgmental. She just educated me on all the options for screening and left the decision to me.
When patients come into the clinic, they want to spend more time with the provider, and providers aren't able to spend that time with them. And by giving them another healthcare representative to talk to, they are able to come out with information that they didn't have before they came in for their visit.
During the visit with the nurse, I chose to do the colonoscopy screening because it seemed like the most thorough way to know for sure that there was nothing going on in my colon. Made a choice to, make it happen, and that way I would have a clean conscience knowing that all was good.
I think SDM has played a large part in the patient experience. I have found that it has empowered the patients to feel more of a part of their decision making. An informed patient tends to be a much more proactive patient and more engaged in their care.
My role as an outreach coordinator for the WISDM project is to get out into the community and educate them through a variety of ways, such as movie theater, ads, parades. We do presentations at the Rotary Club or Chamber of Commerce. One of our bigger places that we go is the Community Health Fair, which is it's a phenomenal opportunity to really educate, be there and educate hands-on our community.
Our focus really is to just get the word out into the community and get community members involved in their health care, focusing on colorectal cancer screening.
In the community, what we've done is we've created this action agency of all these different people that have backgrounds in medical and public service and have looked at this objectively. We can get together and try to figure out what we're going to do next, or find ways that we can go out in the community and raise the quality of life.
The whole purpose behind utilizing these community members was really to find out what our community needs were and how our project would affect or work in our community.
I do feel that shared decision making is very beneficial. I see a huge role for it in the future.
I think shared decision making could be successful in a lot of other areas of healthcare, primarily diabetes, hypertension, vascular disease. The list is endless.
Anywhere you have a choice to make, there's an opportunity to use the SDM process. If we do, we're going to get better follow-through from our patients, I believe.
Oftentimes patients are amazed when they meet with us when we end up telling them that colorectal cancer is the #2 cancer killer today for men and women between the ages of 50 and 75. This screening can save your life.
The result of my colonoscopy was that the polyp that they took out had the possibility of becoming cancerous, so I was extremely grateful that I had the procedure done.
I'm glad, because I don't know if I would have known about this if you hadn't had this resource at our clinic. You know, when I walked in there and my physician said, well, would you like to talk to someone about your options for colorectal cancer screening? And I said, yeah. And I was like, ooh, bonus.